Welcome to this explainer. Today, we're taking a pretty fascinating anatomical road trip right down the human arm. We're going to explore the incredibly intricate pathways of our nervous system to figure out exactly why our nerves sometimes, well, fail us. And honestly, we'll also look at the absolute mechanical wonders that keep them working perfectly most of the time.
So, think about this for a second. Have you ever woken up from a really deep sleep? Maybe your arm was draped awkwardly over the edge of the bed or the back of a chair, and you find your arm is just completely numb. It's heavy, totally unresponsive. It's a bizarre, kind of scary feeling, right? Well, the main culprit behind that temporary paralysis is the exact structure we're mapping out today, the radial nerve.
Here's our roadmap for today. 1. Meet the radial nerve. 2. High radial nerve entrapment. 3. Pin syndrome. 4. The radial tunnel mystery. And 5. Wartenberg syndrome. Let's get right into it. Section 1. Meet the radial nerve, the true highway of the arm.
Okay, let's dive in. The radial nerve is the biggest branch of the posterior cord of your brachial plexus. I want you to think of it like a massive high-speed fiber optic cable, but it's carrying two very different types of data at the exact same time. On one hand, it carries these heavy motor commands, literally powering your triceps and letting you extend your wrist and your fingers. But then, on the flip side, it's also carrying delicate sensory information from the skin on the back of your arm, your forearm, your hand, and your thumb. It's an absolutely critical dual-role highway.
Now, what's really cool is how this nerve travels down the arm and literally forks right at the elbow. It's just like a major interstate, splitting into a business route and a scenic bypass. The radial nerve divides into two highly specialized branches. One is the deep motor branch, known as the pin, or posterior interosseous nerve, and this one dives deep down into the muscle. The other branch is the superficial sensory branch, or SBRN, which stays much closer to the surface just to provide feeling.
Moving on to Section 2, High Radial Nerve Entrapment. We're looking at the upper arm hazards.
Remember that dead arm feeling we just talked about? Well, in the medical world, when this happens in the upper arm, it's often called Saturday night palsy, or sometimes even honeymoon palsy. Because the radial nerve travels really close to the surface along the bone in your arm, just resting your arm awkwardly over a firm chair after a few drinks, or having a partner sleep heavily on your arm can actually compress the nerve. This direct pressure temporarily paralyzes the hand extensors, resulting in a very classic symptom known as wrist drop. You literally can't lift your hand.
But, chairs and heavy sleepers aren't the only roadblocks here. A staggering 70% of radial nerve neuropathies are actually caused by humeral shaft fractures. Breaking that bone in your upper arm directly traumatizes the nerve. There are also some really unexpected traps, too. For instance, elite bodybuilders can experience this entrapment simply because their teres major muscle grows so large that the physical bulk, the hypertrophy, literally crushes the nerve right against the surrounding tissue. Crazy, right?
Section 3. Pin syndrome and motor loss. Welcome to the crowded elbow intersection.
So the crucial thing to understand here is that when the deep motor branch, the pin, plunges into the forearm muscles, it has to run this terrifying anatomical gauntlet. Surgeons actually use something called the rule of 5. These are 5 specific anatomical choke points, almost like toll booths, where this nerve can get dangerously squeezed. We're talking fibrous tissues, vascular bundles with wild names like the leash of Henry, various muscle margins, and most notably, the arcade of Froese.
Speaking of the arcade of Froese, this structure is a major troublemaker. It's a fibrous arch right at the edge of the supinator muscle, and it is by far the most common trap for this nerve. It's responsible for over 64% of entrapments at the elbow. Just picture a tight, rigid bridge that the nerve has to perfectly squeeze under every single time you twist your forearm. It's a really tight fit. Now, when the nerve does get crushed in these areas, doctors classify the resulting pin syndrome into 3 distinct types, all based on the exact location. Depending on whether the compression happens at the entrance or the exit of the muscle, patients might find themselves completely unable to extend their fingers or their thumb, or sometimes both. But notice I said unable, not in pain. Because the pin is almost entirely a motor nerve, this entrapment causes muscle drop, but typically without any loss of skin sensation and entirely without pain. Which brings us to Section 4, the radial tunnel mystery, pain without paralysis.
Okay, so pin syndrome causes muscle paralysis but no pain, right? Well, some patients show up with a condition called radial tunnel syndrome, and it's the exact opposite. It causes chronic, severe pain that feels a lot like tennis elbow, but it doesn't paralyze the arm at all. So you have to ask yourself, how can compressions in the exact same physical tunnel produce two completely different sets of symptoms? It's a real puzzle.
And this puzzle has actually sparked a massive debate in the medical community. Some experts flat out don't believe radial tunnel syndrome even exists as its own separate condition. Take this quote from a researcher named Rosenbaum. He basically argues there's no such thing as a purely sensory syndrome in this area. The prevailing theory to solve this mystery right now? Well, radial tunnel syndrome might just be a very, very mild pin compression. It's not strong enough to paralyze the large motor fibers, but it is just enough to severely irritate tiny, undetectable pain fibers, those little unmyelinated C fibers hidden deep within the nerve.
Because of this, it creates a huge diagnostic challenge for doctors. Normal nerve conduction tests often come back looking totally fine for these pain patients. So doctors rely on something called the Rule of 9 grid. They literally mentally draw a 9-square grid right over the forearm and physically press on those specific zones. By pinpointing exactly which square triggers the pain, they can track the hidden path of the nerve and finally differentiate it from regular old tennis elbow.
Finally, Section 5, Wartenberg syndrome at the wrist, our final destination.
Let's trace that nerve as it heads down toward the hand. After traveling safely deep under the muscles for most of the arm, the superficial branch of the radial nerve finally emerges into the subcutaneous layer, meaning it's sitting right beneath the skin as it approaches the wrist. Now, while this positioning is fantastic for giving sensation to your skin, it makes the nerve incredibly vulnerable to pressure from the outside world.
I mean, because it sits right under the skin, totally everyday objects can become serious compressive hazards. A watch strap or a wristband worn just a little too tight, that can squeeze the nerve right against the bone. There's actually a highly documented historical example of this. U.S. prisoners during Operation Desert Storm developed this exact nerve entrapment simply from wearing handcuffs for too long. Even just repetitive twisting motions of your forearm can cause the surrounding fascia to pinch that nerve.
When this superficial nerve gets trapped, we call it Wartenberg syndrome. Now, unlike the upper arm entrapments that literally paralyze the wrist, this condition is purely sensory. It causes significant pain, numbness, and that pins and needles feeling, paresthesia, right on the back of the hand and the thumb. It is incredibly frustrating for the person dealing with it, and to make matters worse, it's frequently misdiagnosed as a tendon issue, like de Quervain syndrome. Which actually brings us to the end of our anatomical road trip. We've seen how the radial nerve weaves past bones, ducks under these rigid fibrous arches like the arcade of Fros, and navigates super tight muscular tunnels, all just to let you extend your hand and feel the world around you. So considering how incredibly crowded and frankly treacherous this path is, isn't it an absolute marvel that our nervous system functions flawlessly most of the time? It really makes you appreciate every painless movement you make. Thanks for joining me on this explainer, and I hope this leaves you eager to learn even more about the hidden wonders inside your own body.